So number one, we're going to be discussing today the connection between your thyroid and your digestive and elimination tract, specifically constipation. And most of you, I believe, that are on the screen were on the show when I talked about how to test your thyroid. Remember how we did the iodine patch on the left wrist and all that? Okay. This is going to be very important for all of you to do that. And I believe that you can just do a search. Kelly, correct me if I'm wrong, that you can do a search on all of the presentations that I've given, and you can find the form where it shows how to do the patch. But remember that the patch should always be done first thing in the morning. Otherwise, it can really affect your sleep, because it gives you as much energy as if your thyroid was fully functioning. So when you have hypo, meaning low thyroid, and you do the patch, don't do any supplement that day. That's one thing I don't think I clarified last time, and that's my mistake. You don't want to take your thyroid supplement right after you've done your patch, because you're going to get hyper. Okay, that's when you feel like you've had too much caffeine and everything is jittery. So you don't want to do that. That's not a good idea. Not going to hurt you. It's not going to be dangerous, but it just doesn't feel good. So the iodine patch is going to be very important, because if you're having digestive issues, if you're having constipation issues, even if it's on and off, now I'm not talking diarrhea, I'm talking constipation. I had constipation issues for years when I was younger, and nobody ever checked thyroids. I mean, come on, I'm 77. That many years ago, nobody even talked about what to do about thyroid. So when our age comes in, we really know that we've been through it, haven't we? So the important thing is that are any of you here today that have not been in a Waves of Wellness program? Have not heard me talk about the thyroid? Okay, you
yes.
haven't.
I don't know what your
how many more?
Is it just says
EDP? Just put your hand in the
What's your first name? Say it again. EDC 19. What is your first name?
He doesn't know.
Or doesn't want to share.
I think it brings. Okay, so just
My
remember that.
Ed. Sorry.
Oh, Ed.
Okay.
Okay.
My mic,
Ed. Okay.
mic was muted.
That's okay. Thanks, Ed, and welcome. This is the first time you've been on Waves of Wellness.
Yeah, long time listener, first time joiner. We get the recording.
Okay. Thanks so much for being on board today live. We appreciate that. We love seeing who you are. The important thing to remember is the search engine. I even forgot. I was looking for something, and Tracy said, just put it in at the top, and and it does come up. Go into the pages of the blogs, put in thyroid testing, or what would you suggest, Kelly? What's the easiest way for them to find it?
The search engine.
The search engine. So that way you can go back if you haven't saved it. Now, if I were you and you're interested in following the progress of your thyroid's health, I would print it, because it's that important. This isn't something that's a quick fix. As I mentioned previously, in other countries, and me having lived abroad several times, the doctors, the medical doctors that are integrative medical doctors, all check thyroid this way. They don't send you to a lab unless it's necessary for other reasons. If you've had diagnosed Hashimoto's, if you've had thyroid cancer, etc., they will go ahead and send you for blood work, of course, for a full CBC panel, but not just to keep testing it. You can do it yourself. You don't need to spend the money, and you can monitor it yourself. So regardless of what you're taking, whether it's a prescription medication, whether it's the green powder that I recommended that is called Vita Mineral Greens. I think most of you wrote that down. It is, yeah, everybody's shaking their head. Vita Mineral Greens is a green powder that has everything that you can imagine to help detox your body, to help support the thyroid. It's got organic sea vegetables, which is what iodine, natural iodine comes from. And it helps you in so many ways. It is available on Amazon. The health food stores have it. I get mine on Amazon. And it's Vita Mineral Greens is amazing. When you open the jar, please don't be turned off by it, because to me it smells like raw cut grass. Anybody else think that when they open the jar? It's like, oh, like when somebody just cut a wet grass. But when you put it in a drink, you don't taste it. So put it in a smoothie, put it in a little glass of juice of whatever kind you're drinking. Or if you don't mind the wet grass smell and taste, put it in a little water. But it's so good for you. So you don't have to go off and say, okay, I guess I need to do, I use a homeopathic, but especially blended. So if you don't have a naturopath that has a custom formula for hypothyroidism, I would suggest you use the Vita Mineral Greens. I do both because it's so good for you in every other way to detox and to support your body with antioxidants that there's no reason not to do it. The one warning is do not do Vita Mineral Greens at the full dosage recommended on the bottle when you first get it, because it'll detox you too quick. Okay.
Wow, good
And
to
all
know.
of you know what that healing crisis is. You can get a headache, you can feel awful. Have any of you used the Vita Mineral Greens and used too much and gotten the symptoms you have? Linda, what did you experience?
Well, I didn't sleep. That was the main thing.
Yeah.
It came with a little scoop that is about a teaspoon because I measured those. So I had to start taking half of that.
Okay, good. See, so you start, and then how long did you take the half until you were able to get up to a full
Well,
scoop?
I'm not up to the full teaspoon yet. I'm
Okay,
not
so
up
how
to the
long
full,
roughly have you been taking it, hon?
probably about a week.
Oh yeah,
And
that's too soon. That's too soon.
Yeah.
Wait about 3 weeks or so with any kind of sea vegetable that's feeding the thyroid, and then gently go up a little more. Remember how we've talked on our cooking classes too about a pinch and a dash and whatever? Just use a little bit of a pinch besides your half a scoop. Don't go up to a full scoop right away. Then if you go
Okay.
3 weeks and you're feeling okay, then you can go up again. So don't overdo it. It's not like if a little bit is good, a lot is better. Your body is going to detox. You're going to feel so much better. You're going to have energy. Your brain fog starts lifting. All of that, because we have to remember that the thyroid is the master command center. Kelly, I have a question for you. Since you're our resident nurse that really should be a doctor because she knows more than most doctors I know. In conventional medicine, in the nursing that you did, and I know you did a lot of critical care nursing, what was the thought on the thyroid? Did they ever check it for something when they went into for heart surgery or for a heart attack or for anything? Did they ever check it?
A thyroid panel is a standard blood test that they would run when they're thinking about, like what is going on with this person, right? So any good doctor is going to automatically, as part of maybe even your yearly labs, run a standard thyroid panel. Now, based on the results of that, there are more intricate tests that they can run that go much further into the pathophysiology of what might be going on and causing your issues if they see something off. But part of the problem is that so many people are subclinically hypothyroid that according to the numbers, they're within the range, but their body is not responding as if they had a normal thyroid level. And therein lies the problem. And that's where functional medicine can come in and help, bridge that gap between the medical community and more homeopathic or holistic treatments.
That's a great explanation. Yes,
Yeah.
thank you. And remember, Kelly, that we also discussed in another show, and this is just a little introduction before we do the PowerPoint, because I know there's going to be questions. Remember that I mentioned, and I've written it in my thyroid book, that if you're taking, let's say, Synthroid or Armor Thyroid or any other supplement, and you do what Kelly just said, that they'll do a full panel, a full CBC, or a full blood panel, and they say, oh, you're within normal range. But if your thyroid does not recognize that supplement in order to convert it into usable energy, I don't care what the blood test says. Your patch test doesn't lie. Remember that. Body talk never lies. If that patch test stays on 15 hours or more, hey, whatever you're doing, keep doing, because it's great. Your body likes it, it's absorbing it, it's using it. But if it goes away like mine did, less than 15 minutes after I got COVID and I was so sick, it was 15 minutes. And I looked and went, God, did I forget to paint it? I mean, I literally went to put the teapot on, came back to the bathroom, and it was gone. Your body does not lie. It's the best barometer. And so consequently, if you're feeling sluggish, no matter what you do, you can't lose weight if you're doing everything right. Now, if you're doing your exercise, your walking, your bicycle, your aerobics, your yoga, whatever it is that you do, if you're doing what you need to do for your body, you're hydrated well, and you eliminate well every day, okay? Your patch test should stay on if you're taking a medication. That's the difference. That's why I love the patch test. And I remember when I was teaching at the university in Prague, Czechoslovakia, I think I told some of you this story. And I started out with my PowerPoint. We were talking about all kinds of things. I was really talking about inflammation and the invisible disorder of fibromyalgia, because I had it and I was president of the organization for fibromyalgia. So they wanted me to talk about it. And when I started talking about the iodine patch test and showed on screen how to do it, they all went, "Oh, Dr. Gloria, you can go over that. We've done that for centuries." It was kind of like, we don't need to learn that. And that's why, because it's other countries have done it. They don't just go by the blood test. So understand that this is something, what my goal is, and I've said this to Cynthia and to Tracy and to Kelly, is to help you take control so that you can take control of your health. And so many examples of people not being diagnosed properly. And then they come back and I'll say, well, why did they tell you you need these 10 drugs? I don't know. They just told me I needed them. No, that's not taking control. And if you continue to feel that way on a level of consciousness after we have our do-over, and we all are 30 years of age again and healthy and, nice thick hair again and all of the things that we kind of, dilute a little bit as we get older, you come back, you come back after the do-over. And if you don't understand these things, the do-over isn't going to be something that's going to fix your thyroid forever. If you go back to eating things that destroyed your thyroid health, if you go back to a very stressful situation, which we all pray that isn't going to be the case when our world gets its head screwed on straight, then, but you still need to test it. Take control. This is what this is all about. Helping you to cook with food that we know does not cause inflammation, if you're avoiding inflammation, or foods that ignore it. Everything that we learn about our diet, everything we learn about supplements, so that you can take control. And that's my bottom line goal. Okay? So I think we should start. Yes, and then we're probably going to have questions. So I'm not going to go through every word on the PowerPoint. I don't like doing that. It's a lesson for me. It's a reminder for me to remember what to discuss. Okay, let's start this. And this is going to be kind of fun because the PowerPoint's been done differently. Our wonderful new admin, Lena, I did all the text and all the graphics except for a couple. And I said, Lena, polish it up. Do your magic, because she's really good at PowerPoint. So she did. So I haven't seen some of this with her magic. So let's go to Kelly and see what she did to our PowerPoint. This is specifically for QHS members. Look at the great slide in, I call it. I know there's a fancy word for it, but a graphic word for it. But this is your thyroid. It is a butterfly-shaped organ right here. Now I need to give a good testimonial very quickly here. I've had 2 nodules that you could feel. They're about the size of a pea, of a green pea, right here in the middle of my throat for years. And they've always said, don't worry about them. They're not bothering your swelling or anything. And the other day somebody asked me about them and I said, oh, I can barely feel them. So our devices, our frequencies with our handheld devices and our HHS are doing the trick. And I didn't even realize it. So when everybody keeps saying I didn't feel something, I say, wait a minute, I've got things like this that I didn't even think about. I'm so used to having nodules there, and I can feel them, but barely. Before they were very pronounced little P's. So this is your thyroid. Go ahead and go to the next one. But this is where it's see how it's almost at the bottom of where the neck attaches to the chest? It's not up here in the top of your throat. It's at the bottom. But as Hippocrates always said, all diseases begin in the gut. And I want to make a real important distinction here because it has a very distinct relationship with your digestive tract. And if it's out of balance, as I said before, you can have bloating, constipation, diarrhea, IBS, leaky gut, all of these things, because the messages, think of it as the air traffic controller up here, and it's sending messages to every functional biological part of your body. When those messages aren't getting across, there's miscommunication. And so it's not triggering the processes biologically that we need to be able to feel the elimination and to be able to have a good elimination. And of course, other things important, remember the hydration and the fiber. Okay, let's go to the next one. So this is just to remind you, if you ever go, and next time it's kind of fun to do, next time you go into a drugstore or a big grocery store with a drugstore section, look at the products that are stool softeners and laxatives. It's mind-boggling. I looked last Saturday just so I could confirm it, and there was one entire long aisle about 6 tiers high of just something for constipation and diarrhea and stool softeners. And I will tell you, one of the best stool softeners is distilled aloe vera juice. It tastes and looks and feels like water. You don't have to refrigerate it. You can buy it over the counter. Over the counter brand is called George's. Many of you know what it is. I use the same company, but in the professional formula of it. But you buy it, you drink it, if you're having problems or you're having some burning rectally, drink the aloe vera juice. It's distilled. Don't buy one that is colored. I don't care if it's a gel or a juice. Do not buy an aloe product that is colored. That means they put food coloring and all kinds of other bad things in it, okay? Should be clear. And George's brand is a very good brand. And I have nothing to do with the company. I just love their products. Okay, the next one. That's an easy stool softener and to help any irritation in your lower body. So now look at this. See, this is a good example of what I said I found. But mine was one long aisle in the grocery store here in town. And what people don't realize is that there are up to 520 million thyroid sufferers in the world. But most of them are undiagnosed, as Kelly said. They get the blood work and they say, no, you're within normal range, but you're really not. That's why you're having all of the symptoms that we're going to talk about in a minute. So go to the next one. And anyone that's been constipated or has missed a day or two of a bowel elimination that is complete and full knows how horrible it feels. So you can imagine that what happens is if you don't have a bowel emptying every day, that toxic compost pile of yours is recirculating. And that's where we get irritable bowel, Crohn's disease, leaky gut, all of that, because as any compost pile, any of you that have had a farm like I did, know that when you put everything into the compost pile, ours was all, kitchen scraps and things like that. When it ferments, when it putrefies, it creates so much heat that it can ignite its own fire. And I almost started a forest fire. Here at City Slicker from California moves to Idaho, didn't have a clue that it was going to get hot. And I had this beautiful compost pile. All of a sudden, I'm looking out my window because I fed the deer, the moose, and the elk with a manger that we had built. And I said, oh, look how cute. The deer are digging into the compost pile to find some food. And all of a sudden, whew, started a fire. It's a good thing my next door neighbor that had the property next to me was a Forest Service employee and was off that day. I screamed for help, and he got water out of my pond and put it out. And he said, "Don't ever do that. You've got to put a fence 10 feet high." So we did. So that's exactly what happens. Hopefully that gives you a visual. That's what happens in your gut. If it stays in there and putrefies, it gets hot. That heat inflames the delicate tissues that are inside of our small and large intestine, specifically the large intestine. Okay, let's go to the next one.
Just to add to that, I mean,
Absolutely.
having seen this happen to people in real life, when it gets that bad, what ends up happening is the stools at the end of the track get so hard and dry that they actually form like a big ball, right? And so
And it's called a bolus. Yep.
Impossible to pass on your own. And so, not to be gross, but you know, in the emergency room, and in sometimes it even has to go all the way to the operating room, they have to go in and physically remove it, and it's extremely painful. And so you don't ever want to let it get to that point, because that I can't tell you how much damage that causes to the rectal vault and to the anal opening to experience that. And anybody who's ever been constipated for a couple of days knows that's miserable. Imagine being constipated for a month, and I've seen it, and it's horrifying. So please make sure you're having good complete bowel movements.
No, thank you for that, Kelly. You're absolutely right, because it's and I know people that have had to surgically have it removed, have the passage opened. And so that's when I say to my patients, make sure that you have a daily full and complete bowel elimination. I don't mean, oh, a little bit. It feels like there's more there, but the body's not cooperating. No, that's not full and complete. You're either not eating enough fiber or drinking enough water. And so what she is saying is so valid. I mean, I've been in practice over 40 years, and I cannot tell you what a huge problem it is. Plus, people with severe migraines usually have constipation because they take medication for the pain, and pain medications tend to constipate you.
That makes it
right,
worse.
Kelly?
Yeah. It
makes it worse.
Problem, you know. And you know, to be honest, I've even seen people so backed up that it actually comes back up this way, because it's got no other way to go out. And the body's, you know, reaction is to expel it. So the only other way out is this way. And talk about inducing vomit.
Well, and I've also seen it come out in big boils in people that it doesn't come out orally, but they get big boils all over, and they can't figure out what's going on, and they haven't gone to the bathroom for a week or two. So yes, I know that this is a very graphic discussion, but it's an important one, because if we're not realistic about what happens, you can't take control. And I want to teach you to take control. So the underactive thyroid slows down the body's biological system. And it's not just elimination and digestion. Okay? So that happens, and people never go back and connect it to their thyroid as well. So go to the next one, if you will. I love that graphic. Thank you, Lena. Pouring water. I don't know how to do that. That's really cool. Okay, here's the symptoms that maybe you haven't thought about. And I'm just going to go through them real quick. Kelly just mentioned about the hard stool, or what we call pellet elimination, which is like rabbit pellets. They're hard and small. If you're doing that every day, that you're still constipated. Everything is dried out. The moisture has been sucked out by the body, and you're having incomplete evacuation. The reduced number. Now, in the old school of natural medicine, they used to say you have to have a bowel movement for every meal that you eat to be healthy. That's not the consensus now, because our food is different. And so if you have one good, and again, I'm gonna get graphic here. If you have one good, what I call cow dump, everything comes out. It feels clean. It feels like everything's out of your body. That's good enough. Some people are fortunate and do have elimination after each meal. I am not one of those, but I had such severe constipation for so many years that one large bowel movement that is completely voided is perfect. So don't go by, oh, I'm supposed to have one for every meal. No, not in the new way of thinking and the experiences, because our food is different. If you're straining, which means that you're probably going to end up with hemorrhoids, because now you're straining and you're pushing all the veins. You're stressing the veins in the rectum, and they're pretty delicate. They're not tough veins. So that's another thing that happens with people who have chronic constipation. And fortunately, I would say probably 90% of my patients who have very severe hemorrhoids can avoid surgery by doing some of the things that we do. So it's important that you do everything that we're talking about here if you have hemorrhoids. But also, let me give you one more hint, and then Kelly, I want you to interject here. One of the best things to reduce inflammation in the rectum and or hemorrhoids is plain old organic coconut oil. Why? Because coconut oil, remember, is antibacterial, antiviral, and anti-inflammatory. So it's a wonderful lubricant as well. And any irritation in the rectal area can be taken care of with that very, very simply. And you can also use the aloe vera juice. Okay, Kelly, go ahead. Chime in here, please.
What I was going to add was the portion about straining required to pass your stools. This frequently happens to women who have given birth, especially if they have had a oh my God, what's the word I'm thinking of? When they cut you, oh my God,
the
word
C-section.
C-section.
Not a C-section.
C-section, cesarean.
No, not a C-section. Where they actually cut open part
That
of your.
episiotomy?
Oh,
Yes,
episiotomy.
Okay.
It was a burning part right there. Especially if you had an episiotomy along the one portion of your vaginal canal that is up against the back, the back of the perineum, you can have what we call a perineal fissure in there, wherein there's a weakness inside the lining of the vaginal wall. And so when stool comes into the anal canal and is sitting in the rectal vault, it actually pushes into the vaginal wall and creates like a little pocket. It's not open, it just kind of pushes into there, almost like bulges out, and it sits in there. You might even not know it's there, right? But you need to move your bowels, and what's happening is you're straining and you're pushing, and that stool is sort of sitting in that little window or that little pocket, and you don't know that. And so what will end up happening is the woman will eventually feel like, I feel like something's there, and upon like self-examination, they'll sort of feel that fullness in that spot and push against it, and then that pushes it into the right position, and they're able to move the stools through and have a complete bowel movement. Oh, especially if you're a woman who has had children, if you're finding that you're having these incomplete evacuations, or you feel like something's still in there, examine it, and that can be fixed. And it's a completely normal thing that happens. It's just part of, the sequelae of giving birth and having maybe weaker perineal muscles. So that's why Kegels are really important as well. And you can do Kegel exercises and strengthen up those muscles in there, which could also help prevent that from happening. But that's a good thing to know, because you may be straining and really pushing, and you could cause yourself to develop hemorrhoids when that's not really the problem. It's just because that there's this little pocket that the stool is getting stuck in. So I just wanted to add that.
Right. And when it gets stuck in that pocket, it gets hot, it putrefies, and it causes inflammation. So it goes back to what we just talked about a little bit ago. Thanks, Kelly. That was a great explanation. Great addition. Okay, go to the next one. Okay, so what are the common causes? Well, we just talked about intestinal sluggishness, and thanks to Kelly, got a little bit more of a clarification on some of those things that can happen. Let's talk about supplements containing iron. I'm going to squeeze down, because you see that dehydration, and if you're not moving, obviously, if you're, sedentary, this is all going to happen. If you eat too much cheese or low fiber foods, yes, just think of it as being sticky. It's going to stick in there, and you're not going to be able to eliminate. But what most people don't think about is the iron. I have a terrible time with iron. That's why I use and recommend the iron that is vegetable based that I also get on Amazon. Um, and it's because it is better for me, but I still cannot take the full dose. So again, a big warning to those of you that are anemic or need to have a little iron. Don't take the full dose. It comes with a little measuring cup. If you take a liquid iron especially, start out with half a dose or a third of a dose. If you're taking iron supplements and you are constipated, talk to your healthcare professional. Maybe you just need to eat more iron-rich foods rather than the supplement. I've had patients that have gone back to their nurse practitioner, who I work very well with, and practitioner said, just eat food. Look up the food high in iron and just eat food, because her body was not able to tolerate any of the iron supplements. We tried liquid and capsules and pills, and she got so constipated that she ended up in the ER. So understand, if you're doing iron, make sure that that's not what's causing your sluggish elimination or the incomplete evacuation, okay? The overuse of laxatives is a huge thing. Remember the old adage, you lose what you don't use. That's why if we don't do exercises and we don't stay fit like Tracy does, we're going to lose that muscle tone. I know I have. It's very evident. And it's because I'm not able to get out and do what I was doing prior to this time since COVID. So it's important to remember that laxatives are going to make that rectal muscle, the lower part of the rectum, lazy. So if you use something like aloe vera juice, the distilled one, that's not going to cause that. It's not a laxative. If that doesn't work, there's other stool softeners and laxatives that you can use that are natural. But I'm going to warn you, and I've done it once before, there's 2 ingredients, in my opinion, you should never take. And Kelly's shaking her head yes. Cascara sagrada and senna.
Yeah.
Because they will cause dependency. So you can go to the health food store and somebody can talk you into buying a natural laxative or a natural stool softener. If they have those ingredients, Cascara sagrada or senna, don't buy them, because all you're doing is trading one problem for another.
Really,
What
all forms of like chemical laxatives really
Right.
all lead down that road, because what you're doing is you're overriding your body's natural elimination processes, right? So then it's like you
Right.
said, you don't use it, you lose it, right? So the body is like, oh well, if
Right.
you're going to take over, that's one less thing I got to worry about, right? So then it becomes a
Exactly.
self prophecy. So that's why we really talk about, changing your diet and adding in natural foods that increase the motility. Also, if it's not just water and diet, you also need to
Fiber.
move, because when you walk, you stimulate peristalsis in your system. So if you're finding that you're sitting around a lot, and you also have constipation, increase your activity. And I don't mean you need to work out. I mean, you need to go for a walk around your block in addition to drinking your water. Without physically churning that stuff, you're not getting that peristaltic movement like you should. And so you're going to continue to have those problems.
Right. And to Kelly's point, which is very valuable, I love her being on the program because she's in healthcare. When you do the aloe juice, for instance, it's not a laxative. It lubricates and reduces the inflammation. So does the coconut oil. So you're not replacing one over-the-counter chemical thing with something else that's going to make your rectal muscles lazy. It's literally helping things to slide through and to reduce the inflammation. And it can't slide through if it's inflamed. So now the other thing that is really important for all of us, when we're busy, whether you're a truck driver, I have a lot of long haul truck drivers as patients, and they always have constipation issues. My father and both my brothers were 18-wheeler drivers, and they always had constipation. Why? Because they don't want to stop every time to go to the bathroom. They don't drink a lot of water for the same reason. And what happens is, as you ignore the urge to either urinate or have a bowel movement, you're just causing more gas and bloating in there that's going to continue to inflame the tissues or the prostate. Do not wait. I know sometimes it's unavoidable, but even on a flight, if you feel like, oh, I'm in the window seat and I don't want to bother somebody, the heck with it, bother them. Because if you sit there and hold it too long, you're going to cause other things that are not healthy for your body, and there's no reason to. If you have a problem with frequent urination, for instance, get an aisle seat. Don't get in the middle or on the window. So now we've already talked about the fact that some diseases like hypothyroid causes constipation, and also the structural issues. I mean, if you have the hemorrhoids or polyps. Okay, let's go on to the next one so we don't run out of time, so we have plenty of time for questions. So the gut thyroid immune connection. This chart is hopefully simple enough that you get it. If you have a low thyroid hormone function, okay, it goes down. What does it do? Causes inflammation. What does inflammation do? Causes an immune dysregulation, in other words, imbalance. And then when those two are not corrected, you end up with leaky gut. Okay, so it's all connected. Let's go to the next one. I think one of these shows it a little more. Okay, so there's that butterfly again, your thyroid, okay? But if you have a sluggish liver as well, because of low thyroid function, you're also not going to be processing your food through phase 1 and phase 2 of the liver. Remember that I've described the liver phases as like a vacuum cleaner. You've got a pre-filter and you've got the regular filter. The body has to be able to get everything that you've consumed through phase 1, which breaks everything down, helps you absorb all the nutrients and whatever it is that's in that food that's valuable. And then it goes on to phase 2, which is kind of like the big filter, your HEPA filter. Phase 1 is like your pre-filter. And so if that isn't working, if your liver is sluggish, or you're taking a lot of medications that are drugs, they're pharmaceuticals, synthetic things, then you're overworking your liver, and that could be part of the constipation. It can be part of the low stomach acid, which causes heartburn, belching, bloating, burping, the whole bit. But it also stems from the thyroid, from your butterfly up here, okay? Adrenal fatigue, those tiny little glands that look like a little walnut sit on top of each one of our kidneys. Those are our stress glands. Those are the ones that when we're in a fight or flight, get you through it. But when you're in a constant fight or flight, and I know Key talks a lot about this, there's damage. And that's what we call adrenal burnout or adrenal inefficiency, because it can't protect you the next time you go into a stressful situation. But it can go back and be a consequence of the thyroid not producing the thyroid hormone that you need. It's low in function. Okay, go to the next one. And remember, we'll make this available to all of you. So, pardon?
Just to add to the adrenal fatigue causes your cortisol level to be extremely high, and high levels of cortisone are a precursor to diabetes. So just because your thyroid is, you can develop diabetes, even if you're not taking in excess dietary sugar. So it's like a whole big like circle that everything affects everything else in the body, right? So.
Well, and one thing I had forgotten, Kelly, that you reminded me, because I am type 2, is she says your cortisol is usually going to be higher in the morning. And mine is higher. That's why my blood sugar is higher in the morning. So she's right. It's this vicious circle. And this is going to explain it even more. Thank you, Kelly, for that. So there's your butterfly again. And you can look at this later in detail, because you're going to get, you'll have access to the PowerPoint. But I want to point out a couple of important things, because your secondary bile acids, which, remember, bile is produced in the liver and stored in the gallbladder. So let's say you don't have a gallbladder. We've talked about that before. Now you've got to really make sure that your thyroid is able to help you because you don't have that bile being produced the same way and being stored. Okay? Then you've also, because of all of that, now you have a reduction of the bacterial diversity. That's what we've talked about so much in your microbiome, that big fancy word that just means a balance of good to, or I should say, health enhancing to health depleting bacteria in your gut. You've got to have a little bit of both. It's like an army having the best training and the best ammunition, and then they don't use it for 20 years, and all of a sudden there's a some kind of disturbance and they have to use it. Well, the army that is fighting them is going to be able to take over because they don't have their skills. It's the same thing with the microbiota. You have to have the good bacteria and the bad bacteria because they keep each other in check. And when you have candida, or the fungus that we talk about so much on this program, you have too much of the bad bacteria and the good bacteria can't eradicate it. That's why you need probiotics, pro meaning for health, antibiotics meaning against health. That's where that whole microbiota, all that, basically it's little fingers like that are in your gut, and that's where it protects you from all of the toxins going through into your bloodstream. So there's your small intestinal bacterial overgrowth. That is your candida. They just call it a fancier name than we do. But look at the center of the chart. Vitamin D. Most people don't think about vitamin D being important for the thyroid, but look at it. It's directly related to your immune system, and go back up on the arrow and it goes back up to autoimmune thyroid diseases. You see the difference? That connection is really important. I don't go in the sun. I get violent headaches since I was a child if I'm in the sun a lot. And so every woman in my dad's side of the family has the same issue. We all have to wear hats when we go out in the sun, and thank God I love hats because I have a big collection of them. But when I lived in Ecuador, it was a challenge because I couldn't go outside. I was at 8,000 feet right on the equator. And I had to wear a hat when I went outside. What happens is then I'm deficient in vitamin D. And it's also proven that every person that got COVID was deficient in vitamin D. That's some of the latest studies. I find that very interesting because I had a horrible case of it, ended up with a concussion and everything else. So let's go to the next one. So don't forget your vitamin D, everybody, please. It's very important unless you're like Kira, who's in Florida and she's in the sun a lot. She probably doesn't have any issues with vitamin D, but I do. So the gut thyroid bacteria connection, here you go again. You've got poor gut health, suppresses your thyroid. So now we're going to go the opposite direction. Instead of the thyroid causing that, if you take, for instance, a lot of antibiotics, you've killed all that good bacteria. Now you have a lot of excess candida fungus. That's going to go up the chain and affect your thyroid function. So that's why doing the patch test, let's say you have a bad infection or you had surgery and you need to have the antibiotic. I mean, that's important at that point. You don't say, no, I don't like antibiotics because they're anti-health. No, you can't do that. You need them as a life-saving technique at that point. But you have to be aware that as soon as you're off the antibiotics, you've got to do the probiotics and rotate them like I've talked about in the past. That means if you buy, for instance, in my practice, the lowest one that we have the pharmacists make is 60 billion in one capsule. There is special ones that I use that are for women only, and they're 60 billion. But you don't want to take the same one all the time. It goes all the way up to 100 billion microorganisms in one capsule. So you rotate. Every one is always done and packaged and measured for 1 month's supply. So just rotate them. If you buy a 60 billion this month, next time when you need some more, get 70 or 80, or get 90 or 100, because then you're tricking that bacteria in your gut all the time to stay on alert, stay sharp, keep their skills up so that they can fight any invading bacteria. Okay, let's go to the next one. Which probiotics do I recommend? I'll talk about that in a minute. Thank you. That's a good question, Don. Okay, so low stomach acid. Oh my God, am I a champion on that one? I've had lots to do with that. Stress will cause low stomach acid. I still have my gallbladder, thank God. Many other parts of me are gone, but my gallbladder's there. And so it's important to understand that a low thyroid function will cause low stomach acid, and low stomach acid can cause low thyroid function. Look at the connection. I mean, if you don't believe in the connection of everything, that chart shows it all. The hormone clearance and the levels of the low thyroid function are very important. The sluggish gallbladder and that reduced bile flow that comes from the liver and gallbladder. So remember, if you don't have a gallbladder, you better be taking digestive enzymes, and you better be taking ones that are formulated. And I've talked about this before. Life Extension has a fabulous one that is extraordinary enzymes. See if you can see it here. Extraordinary enzymes. You can get them on Life Extension. I think you can even get them on, you're better off getting them on Life Extension. I think they're a little less unless they have a minimum order. But those say right on them, formulated to digest fats and protein. So if you're eating a great big green salad, you don't need them. It's your gallbladder that's missing. So that, you disagreeing with me or agreeing?
I was agreeing. Yeah, you don't need them if you're eating a
okay.
salad.
So no, that's okay. So if you're eating a great big green salad, you don't need them, because without a gallbladder, what you need is the bile that you're not getting because it's stored in the gallbladder. So you need to have digestive enzymes that are formulated for fat and protein. And Life Extension, the reason I use it even in my practice is it's the only one that I have found that specifically says, and I love Life Extension. I've been to their facility in Florida and their quality supplements because they're well tested. And it says, I'll read you exactly what it says. Formulated to facilitate digestion of protein and fat, not starches and sugars. So if you have a big bowl of pasta, that's not the enzyme to take, okay? And so let's go to the next one. So this shows you the interconnection. I mean, that gallbladder is that tiny little pouch, for God's sakes. It's about the size of a fig, and yet look at the problems it can cause us. Now, in order to heal the gut thyroid axis, how many more slides do we have? I think there's only like 2 or 3, isn't there? Can you tell me?
I don't know. I have to leave the presentation to show you.
Lena probably knows.
Oh, we have
One
2
more?
more after this.
Okay, all right. So I'll talk a little faster. So first, figure out the cause. Are you lacking thyroid supplementation because you did your patch test? Okay. Do you have candida, the fungus that is so invasive? Do you have chronic stress? If you do what you can. What Kelly said, just go for a walk around the block if you can't go anywhere else. But move your body so that all of your biological systems are getting circulated and moved and used. Second, address the factors and remove all the triggers. And third, restore the integrity of the gut, like we talked about. Make sure that you add probiotics, that you do a liver gallbladder detox that we've talked about in the program. You can search for it. And even if you don't have a gallbladder, you can still do the detox program so that you can get anything that is sluggish that is in the liver, it'll dump it. It's a liver gallbladder cleanse, not just gallbladder. Okay, let's go to the next one. Oh, no, wait. This is important, and you won't have to write it because you can get the slide. The last item, the L-glutamine. L-glutamine is an amino acid that is extremely important in the GI tract. When I had leaky gut after my accident, the drugs they gave me to save my life almost killed me. My liver shut down. I ended up with leaky gut. And L-glutamine is what helped me heal the gut. It's a white powder. It's not expensive. As long as it's pure organic L-glutamine, it doesn't matter what brand. I think the one I have is pure encapsulations, but you can use whatever brand is organic and or pure. Don't have it with other ingredients. And you just follow the directions. If you're using a smoothie or you're just going to put it in water, that helps heal the gut lining. And with leaky gut, that's what happens. All of those toxins that are in the colon are seeping through into your bloodstream. I wish I had the picture or the slide of what my colon looked like at the time, because it was disgusting, but it, a picture's worth a million words. So L-glutamine is what you use. It's the only thing we know of that will heal the gut lining specifically. And it's a natural amino acid, so you're not adding anything that is detrimental to your health. Okay, the next one. Okay, what to do? First of all, evaluate that thyroid function with your patch test. Have plenty of fiber-rich foods, and make sure that you think about those goitrogenic foods that promote thyroid enlargement. We've had a whole show on that. I don't remember who did it, but it's very important that if you have an enlarged thyroid, that you avoid the goitrogenic foods. Maintain plenty of hydration. My rule of thumb in my practice is half of your body weight in ounces, unless your medical doctor says otherwise, or unless you have renal failure. So that means if you weigh 200 pounds, you need a minimum of 100 ounces. Somebody like Tracy, who is very athletic and in really good shape, still does a gallon a day. She doesn't do a gallon because she weighs that much. She does it because she works it off. She sweats. She works out every single day. So if you are working out like Tracy does, you need to increase it even more than half of your body weight. Add omega-3s. We've also talked about that on the show. Omega-3s reduce inflammation and help you live longer, help brain function against any kind of a cognitive disorder. Omega-6s cause inflammation. Those are your bad oils that we've talked about. The omega-6s, the canola oil type family. Use the extra virgin olive oil, both internally, rectally, or vaginally. It works both ways. It's also a wonderful vaginal lubricant for those of you that would like to try it that way. It's wonderful. And then add magnesium, because magnesium has so many good side effects, relaxes all the muscles, help your brain to calm down, helps your adrenals, and it also loosens your stools. So that's another good way to be able to get a stool softener with a side benefit of magnesium. But remember that you have to do it to tolerance level, because you can get diarrhea from too much magnesium. And then professional colon hydrotherapy. I don't recommend high enemas. They're too hard to do on yourself. But professional colon hydrotherapy by a certified therapist saved my life, because with leaky gut, there was no way we could get all of that out of my system. And I went 3 times a week, then for weeks, and then twice a week, then once a week, and it's literally saved my life, which is why I became president of the International Colon Association, because I was nominated to be president of the international part, not the local national one, but the international. And our job was to make sure that everyone that went through their certification was complying to all of the FDA and other countries' principles for the highest safety features, that they were doing their profession in the highest standards. Okay, I think that's it, isn't it?
It is.
Yes. Was that a help? Shake your head, say yes, yell, scream, whatever. Did you get, even though I had to get a little technical there, a little bit of graphics verbally as well, but did that help you? Is it something, did you learn something that you haven't known before? Raise your hand or just speak out. Okay. Do you want to call him Kelly, or do you want me to?
Let's see. Did anybody actually raise their hands?
Jill raised her hand. So did Kat. I didn't see anybody else's real quick.
Go ahead, Jill.
Okay, so let's start.
Yeah, I
Go
did
ahead, Jill.
earlier. I did, because I came to the patch test session, and I mentioned that the guy that I see is hyperthyroid and has Graves' disease, but we did the patch test, and you said he might be surprised. Well, his was gone in like 4.5 hours. Thyroid, the iodine. So I realized today was hypothyroid, but I learned a lot about my own personal life by being here, from having my children, the things that I've gone through. And as to
Mhm.
him, it was interesting because he always assumed that he had a lot of thyroid or a lot of iodine in his body and he shouldn't have any
Is he
iodine.
on medication, Jill?
He does, yeah.
Is he on medication from the,
Yeah,
okay,
he
for
takes,
thyroid, right?
yeah, he is. And of course,
Okay,
the
so let
doctor
me
recently
address that.
thank you.
Let me address that. It's very important for education for all of us. When you get blood work done and they say, oh, you're on thyroid, you're on synthroid, and you're within normal range now, you're fine. Think about it this way. If you took cocaine every day and you got a blood test, it's going to show in your urine. It's going to show in your blood. It doesn't take a rocket scientist to figure out if you're taking the same substance every day, it's going to show in your blood. But does that mean that the thyroid recognizes it as a natural food, let's call it a food, in order for it to function? The thyroid is still starving. When I had my blood work done and I was so deficient, they said, oh, you're fine. I was on synthroid in my 20s. And it wasn't until I left dentistry and went into natural health that I realized, no, I'm not fine. I was very deficient and had all the symptoms of hypothyroid. So I can't give you medical advice, but I can tell you that if you're taking a medication and you're getting it tested with blood work and you're not feeling any better, you better look at the fact that maybe your body isn't converting it. Okay, that's all I can say about that legally. Thanks, Jill.
Thank you.
Okay, who's got their hand up? Don?
Hi, thank you. This was really a fascinating
Hi.
talk, and I learned so much. So I have a question. You're welcome. I was working on a 21-day detox program with standard process, and I'm on day 14 now. But the first 7 days, I had no BM. I was drinking 12 glasses of water a day, mostly eating about 3 vegetables to every fruit. And so what do you recommend when you're still having those issues?
If you remember during our cooking class, you mentioned that. And I said, oh my God, you can't miss that many days. I can't talk about that line of products. I know them very well, and I get some products for my institute from them. But I don't believe any diet that is causing you to not eliminate, if you're being strict with it, is healthy. I'm sorry. You're putting in this vessel, which is your body, you're putting in good things to help you because they have good products. It's not that they're bad products, but you're not able to get out the stuff that you're trying to get out to detox. And the reason to do a special diet is to detox, to give the body the ability to repair itself, which is what our frequencies are doing, but it's not going to help you if you're not eliminating. So I don't like what you said, that your symptoms. So just do whatever you have to do. I always used to tell my patients, I don't care if you have to use dynamite, but get it out. You can't miss a day. Does that help you without having to give you medical advice? Okay.
No,
thanks for sharing.
It does. And even when I'm not on the detox program, I still have those issues. But, it's not.
Well, that's why I'm saying you need to take care of the other things. But there are some wonderful stool softeners and things that you can take that are not habit forming. Okay, just watch those 2 ingredients, because a lot of the companies do have those too, Senna and Cascara Sagrada. You're welcome, hon. Thank you. Okay, I can't see. Is that Kat? Yeah, that's Kat.
That was next.
Hi, yes,
hon,
I've had leaky gut for many, many, many years. I learned several things today. One of them was the episiotomy thing. Yes, I understand those. And also,
thanks, Kelly.
Yeah, and I helped Kelly with that because I recognized that I was having a baby over the age of 40, almost 9 pounds, and I had no anesthetic and an episiotomy. So I know all about those.
You know all about
anyway,
it. Okay.
So I've had leaky gut for as long as I can remember. But I always had a stomach ache anytime I ate, because I did landscaping for like 30 years professionally. And I would take medication, over the counter, Aleve, something like that. 12-hour Aleve, I'd take 2 or 3 a day, which is
Mhm.
a little bit, if you do the math, it's not good. So I
No, it's
learned,
not on your liver or your
learned-
colon. Yeah.
yeah. And I, of course, I wasn't thinking that I just needed to get the job done. So that was my head, but I had both knees replaced. And after the second one, that's when it really got so bad that I talked to my naturopath and we went together on all these things back and forth. And she said, okay, I think you should stop taking any of the over the counter meds. So that's when it really came. But this has helped a lot because I can eat a lot more things with these units. I can eat a lot more things than I ever could before without being in total pain. So that is really helpful. So keep going. If anybody has leaky gut, know that there is help with this, and just be smart.
There
with
is
what
help.
you
I
find.
almost died from it. Yep. Be smart.
Well,
Do you take L-glutamine, Kat?
No,
For
and
your
that's one of the
leaky
other
gut?
things I was going to tell you that I learned about changing
Ooh.
the probiotics up again, which I have not been doing. And then the amino acid, the L-glutamine, I cannot wait to start looking to see
L-glutamine?
if there's anything in my things I'm taking. So I will definitely be
Right. And
doing
just
that.
make
So
sure
thank you.
that you get an L-glutamine that's just L-glutamine. Don't get it with a bunch of other additives or
Okay.
flavorings or anything else. You want just the
Yep.
pure white powder that is what
Yep.
helps heal the
See,
gut.
I wrote
It
that
helps
down
it
right here.
heal.
So it's like, this is
Thank you.
my to-do list now. And I was so excited. I was
This
like,
is your
hey,
to-do.
I could use that.
Thank
So
you.
anyway, thank you
That's
so
great.
much. This was very helpful.
You're welcome. Okay. Who's got their hand up? Ed.
Yes, I was wondering about prunes. Can you use that as an elective? Is there any problem with using that?
Absolutely. Absolutely. But let me tell you about prunes. If you don't have candida, have you seen the show that we did on candida and how to test with the saliva test with candida? Okay. If you don't have candida and you don't have diabetes or a blood sugar issue, prunes are amazing. Even if you steam, if you just boil them and you drink the water so that you have natural prune juice, that's okay, Ed. But in my case, with having blood sugar issues, can't do it. I don't have candida anymore, thank God, but I do have the blood sugar, and it just spikes me. So it'll go up 50 or 60 points
So you're
just with
saying
one
it's
prune or
high in
one date.
sugar, and we should watch it.
Yeah.
Any dried fruit is high in sugar. It's like putting an IV
But
of sugar in
especially
your arm.
prune.
Yeah.
Prunes are very high in sugar. But
What?
my experience with that, is if you're constipated and that works for you, I'd rather have you take the prunes on an occasional
Right.
basis. Don't do it every single day necessarily, but on an occasional basis, it's a
Right.
very natural way for you to have a good bowel movement. And you can always
Yes.
cut down your sugar intake that day. You can drink more water. You can exercise. There's other things you can do to lower your
Right.
sugar on that day that you take the prune juice or the prunes, So don't totally, block it off of your list because you have
Right.
diabetes, because you have candida. But, if it's working, use what works. That's natural, right?
Right. As
Just-
long as you don't have the other two factors, okay? Just be
Yeah.
careful. And again, Ed, you can buy prune juice, and that's great if it's, unsweetened pure prune juice. But what my grandmother who raised me, who was a herbalist and a midwife, she always bought the prunes, boiled the heck out of them, and she ate them like a dessert, like a stewed prune. But she would drink the water, and the water was just as effective for constipation. And she was on dialysis at the end, and that's the only thing that helped her was the prune. But we weren't worried about other things with her at that point. So thank you. That's a good question. Just remember moderation and check your, make sure your blood sugar and your candida are in check. Okay. Linda.
I have a question about candida.
Yes, ma'am.
People who live in the same house pass it back and forth? Or okay, that's
Ask
what
Tracy.
I wondered. My husband will
because
not
she
give up
is
his
so strict.
sugar or gluten, and
I know.
I got rid of it,
and it's
but
tough.
then I ended up with it again.
You'll pass it back and forth. It's just like the reason that children that are breastfeeding will get it back and forth because they're still breastfeeding. The mother has it. You get rid of it in the child, and they continue to breastfeed. So it's usually with the babies that I've worked with. I don't work with babies anymore. I would have to make sure that the mother does everything she has to do to get rid of the candida. I mean, we had babies that I have pictures that would make you cry, that were just raw with eczema. And it was all the yeast that they had, and their little tongue was totally white, thick coated, looked like a shag rug. And so, yes, to answer your question, you definitely pass it back and forth, both
Okay, so
vaginally
my only hope is to
and
keep
with
taking
kissing
the
or
pure.
eating off of somebody.
So my only hope is to just keep taking my pure encapsulations, caprylic acid tablets.
Yes, caprylic
Okay.
acid. Yes, that will help keep it in check. Yes, absolutely. Yes.
Okay, thank you.
Thank you for that. That was important.
Nancy G wanted to know what brand
Probiotic.
of you recommend.
And prebiotics too.
Prebiotics you can get from fermented food, Nancy. You can make your own. On Monday, we're going to be not cooking because you don't cook them. We're going to be making pickled red onions, and some people are going to make pickled garlic or pickled beets. If you eat anything that is pickled like that, that is a prebiotic. Also, when you take the green powder that I talked about, that's the vitamin greens, that is a probiotic. Okay, because it has spirulina and moringa and all kinds of stuff in it. Excuse me, my gardeners are outside my window if you hear a roaring. And as far as probiotics, I think that over the counter, the best thing to do is to go to Life Extension. They have a huge variety, and I trust them. I mean, some of the companies, I know the pharmacists or the companies that make it for them, and I don't feel as comfortable as I do with Life Extension. There's several good ones, but they're usually prescription strength. You have to get them from a practitioner. But as far as over the counter, get them from Life Extension. Then you can't go wrong. And if they have one for you women, if they have one that is just for women, then get that and put it into your rotation, because those are probiotics that are specifically for a woman's body. They don't have one for just a guy, unfortunately, yet, but they do have one for women, okay, so that it supports our vaginal area and all of our female hormones. Does that help you?
It does.
And remember to go up and down the ladder. Remember, start with, don't go less than 60. 60 billion is the least you should go as an adult, and then go up to 100 billion if you can find the 100 billion over the counter, okay?
I take them, and I actually have a one-on-one with Darlene on Saturday, and that's one of the areas that she's recommending too. So,
okay.
Yeah.
Yeah, you need probiotics big time. Dr. Rich. Yes, sir. What can we do for you?
That's awesome. I tuned in a little later than in the beginning, but it's the part of it you're talking about is amazing. I want to just add something to I do the prune method. I've done the prune method. The prunes have a sugar in there that's may cause gas. So I use some.
Yes.
I put some spices in there, such as chamomile and some ginger and some cinnamon to kind of like ginger has a relieving level of it, and it does work with the digestive tract easily, and so does I think cinnamon.
That's a great idea for those of you doing it. I remember as a child, my grandmother stewing it and putting some herbs in, but to be honest, I don't remember what they were. I know she used cinnamon, Dr. Rich, but I didn't think about the chamomile and some of the others. So that's a great suggestion.
It's extremely powerful. Now, when I do it, I boil it, like you were saying, and then I just blend it up and sometimes I'll blend it up if I feel like I want to use the fiber as well to push out some of the stuff. And so I think that's really a powerful thing. And the juice that they sell on the market, I don't know if it's that.
I don't know if it's pure either, even though it says pure. I agree. But Dr. Rich, you had another good point. If you're doing a smoothie or some kind of a shake, like putting in your green drink, then just put in the whole thing, like Dr. Rich said, with all your herbs The cinnamon is anti-inflammatory. It's good for blood sugar. There's a lot of things in there, calming the adrenals is the chamomile. So what he just mentioned is very important. And just use it all. Don't just use the water or don't just use the prune. That's great, Dr. Rich. Thank you. I hadn't thought about that, but Mom used to do that.
Also, I want to
just
give
really
you
don't know what you used other than.
There's one other thing that I've used in a strong constipation that's very stubborn. I've used a product called magnesium oxide with that's
yes.
It's what do you call it? Ozonated. You know what I mean by that?
Oh, well, yeah.
Yes, I do. But magnesium oxide can be very habit forming. So that's really good when you need to.
You only do it when you need to.
It has to be.
You know, in an emergency.
Yeah, you only do it when you need it, and I agree. Magnesium oxide is very good for that.
It
does. It does work. Yes. Well. Good. Thank you.
Yeah.
Yes, it does. All of the magnesium supplements I take don't have oxide because it does cause loose stools. So when you're using it for, like Dr. Rich is saying, that's the perfect way to use it, but not in a formula every day.
Another thing that I've used too is if I feel like I'm at a place where I need to have that happen, and it's not happening, I'll go and do something like watermelon, and it pushes it. It just the all water, all the hydration of that goes right into the colon, and it pushes it right out.
Oh, it's funny that you said that. I have a farmer in Texas who has a lot of those issues, and he does his smoothie every morning. And he said not too long ago that what he does is take watermelon, seeds and all, and puts it in his Vitamix and makes his drink that way, and that pushes it out. So I don't think you can get watermelon all year, but Dr. Rich is right. The watermelon with the water content, high water content, and the seeds, if you grind them up, you're not even going to taste them. That's another good way to get some fiber.
And if you use a lot of watermelon, it doesn't have any sodium in it, so you can put a little salt on it to make it easy for it to be balanced.
Right.
So I've been through a lot of.
Thank you for those for those tips. You've been through it, huh? So have I. Wow. Thank you. That's a big help.
All right. Thank you very much.
Okay. Anybody else have a comment? You're welcome, Dr. Rich. Thanks for joining us. Just let us know what you benefit from, what you like, what you don't like, and always let me know what subjects you'd like me to write about or teach about, please, because this came from somebody that said, I always had constipation issues. I've got migraines. I don't know what to do. And I went, that's my next call. So if you have things like that, put it in the blog. I'll see it and I'll prepare something to be able to help you through it. Okay. So a lot of issues you have that I may not have talked about already. So please let me know. That's important. And that way I can help you to take control. Okay. Everybody good? Thank you so much. And thank you for the help that you did. Where's Lena? She's sitting here somewhere.
Lena had to go.
And, and also Kelly. Okay. Thank you, Kelly, for being our conductor as always, and for your wonderful professional input, because that's so valuable. Thank you, everybody. God bless. Stay safe, and hope to see you all on the call on the Q&A on Friday.
Bye, Dr.
Thank
D.
you.
Thank you.
Take care.
Thank you,
Bye-bye,
Dr.
honey.
Gloria.
Thank you.
So
Thank
I'm
you.
going to
Welcome, sweetie. Thank you.
Good information. Thanks.
Thanks, everybody. I'm
Bye,
going to get,
everyone.
well, I'm still going to have the meditation for anybody who wants to stick around for that. So I'm going to get that ready for everybody, okay?
Welcome to today's Miracle Moment Meditation, brought to you by QHS and Key. Before we begin, let's take a minute to understand the power of our collective connection using the QHS technologies. When we gather, we exponentially magnify the quantum twine wave effect, delivering twine waves to each device and each one of us all over the world, including all members, even those without devices, the people you intend to support, and the earth itself. The Miracle Moment meditations increase and expand the quantum twine wave effect for every live participant, and with each additional QT wave, and QTWE HHS connection. Every system added to the network increases the powerful, profound conscious quantum twine wave through each and every participating member. This is magnificent, coordinated, and collaborated communication with every device present in nano-fast times. As more QTWE HHS and QT waves join the live Zoom calls, the effect is amplified even more. Today, we will be guiding you through a meditation. It's important to note, this meditation will last about 20 minutes. We encourage you to remain present and aware throughout the session. If you experience visions or emotions, that's normal. Allow yourself to feel and acknowledge them and stay present. The meditation has several parts, each designed to guide you toward a deeper state of relaxation and connection with your inner divine essence. The first part focuses on inducing deep relaxation, allowing you to enter a state where your mind and body are receptive to transformation. The second part involves connecting with the quantum twine waves, Christ energies, and the God spark within you. This connection facilitates a profound alignment with the universal energies of love, healing, and wholeness. In the third part of the meditation, we expand upon your wellness, allowing you to fully experience and remember your innate wholeness and vitality. In the fourth part, we enter into a moment of serene silence. This silence provides an opportunity for quiet introspection and connection. This quiet reflection allows you to focus inward, tuning in to whatever thoughts, feelings, or insights arise within you. We also encourage you to strengthen your bond with the quantum twine waves during this silence, tuning in to their gentle presence and allowing their healing energies to flow freely within you. Finally, we conclude the meditation, bringing our practice to a gentle close, ensuring you feel grounded, centered, and rejuvenated. Remember, the quantum twine wave is scanning each participant head to toe, and then sending healing quantum twine waves as needed, wherever needed, as requested. In a moment, we will ask you to mute your microphones and speak out loud how you would like the quantum twine waves to assist you, whether it's supporting a specific part of your body or helping someone you care about. Express your intention clearly. Once you've stated your intention, take your QT Wave device and place it on the part of your body where you want to focus attention and manifest change. If you don't have a device, you can place your hand wherever you would like to focus your attention. If you intend to support someone else, you can place your device or hand on the area of your own body where they need support. Remember, when you heal it in yourself, you heal it in others. Throughout this meditation, feel free to move the device or your hands to other areas as needed. If you have an HHS, please turn it to 20 now. At the end of the session, remember that the effects will continue to work, so if you feel the need to rest, take time to do so. Thank you for healing this beautiful world, starting with you. Let's begin by muting our microphones and stating our intentions out loud. Begin by allowing yourself to settle into your current position, feeling the natural comfort of your own presence. Now gently close your eyes and turn your attention inward. Notice the natural rhythm of your breath as it flows in and out. Take a full, deep breath. Feel this breath filling every part of your body, nurturing and soothing you from within. As you exhale, allow yourself to let go of tension and discomfort. Recognize that these sensations are not you. They are transient, merely passing through. With this realization, watch as they dissolve into nothingness, leaving no trace behind. You are boundless, free from these sensations and their definitions. With each breath, feel them dissipate as you become more present, more peaceful, and profoundly centered in your true essence. Now let's deepen your experience with a breathing exercise that will enrich your meditation, creating a beautiful synergy between your inner and outer worlds. Focus on the soft sound of your breath at the back of your nose, reminiscent of the gentle whispers of ocean waves. The audible sound of your breath, like the ocean waves, anchor you to the present, connecting the vastness of the outer world with the depths of your inner being, automatically establishing harmony and coherence between your body, mind, brain, heart, and all of your energetic and spiritual systems. There is nothing else to do but be in this moment, deeply relaxed, fully supported, and profoundly at peace. Now bring your attention to your body. Identify the part of your body that feels the most relaxed at this moment. It could be as small as the tip of a finger or as large as your entire back. Focus your attention on this area. Observe how this relaxation feels, how deep, how serene it is, and imagine this feeling beginning to spread. Like watercolor on wet paper, allow this sense of relaxation to expand, moving gently to neighboring areas in your body. With each breath, this soothing sensation grows, filling you up. Breathe deeply, rhythmically, and with full breaths. Imagine the relaxation spreading further and further. Notice that it's no longer just a part of you that's relaxed. Your entire being feels embraced by this calming energy. As you continue to breathe deeply, envision waves of relaxation cascading across your body. Each wave washes over you, bringing deeper calm and more profound peace. These waves are rhythmic, aligned with your breath, sweeping through you, around you, beneath you, and even beyond you. Feel yourself being carried by these waves of relaxation, deeper and deeper into a state of complete serenity. Here, in this space, you are free to explore the depths of your inner world and to dive into the vast ocean of you. Now, let's tune in to the quantum twine waves. Take a deep, full breath, allowing yourself to fully immerse in the presence of the quantum twine waves surrounding you. Feel these waves embracing you, infusing you, and offering their gentle support. As you inhale deeply, visualize the quantum twine waves penetrating your body from the crown of your head to your toes. Sense the waves flowing through you, fostering a profound connection and resonance with your perfect wholeness. With each exhale, release any tension or resistance, allowing the quantum twine waves to permeate every aspect of your being. Notice the sensations as these waves interact with your cells, filling them with radiant light and revitalizing energy. Experience the warmth and vitality of this divine presence as it spreads throughout your entire being. Acknowledge the presence of Christ consciousness, the sacred energy that embodies unconditional love, compassion, and healing within these waves. Feel this divine energy permeating every aspect of your being, illuminating your path and guiding you toward wholeness. As you breathe in, envision your cells awakening to the healing energy of the quantum twine waves and Christ consciousness. Feel a harmonious alignment spreading throughout your body as every cell vibrates in tune with waves of wholeness and unconditional love. Continue to breathe deeply. Surrender to the process of integration. Trust the quantum twine waves and Christ consciousness. Intuitively know where they are needed, guiding you toward a state of wholeness and well-being. Witness yourself as you bask in the deep sense of peace and relaxation that accompanies this surrender to divine energy. Now shift your awareness inward to the God spark residing within you. This sacred essence serves as your eternal connection to the source of creation, reminding you of your inherent divinity and sacredness. Feel the God spark igniting within you, filling you with a profound sense of purpose and empowerment. Witness as it radiates throughout your entire being, illuminating every cell with its divine light. Feel the quantum twine waves harmonizing with your God spark and the Christ energy, amplifying their power and potency. With each breath, these divine energies mingle and merge within you, creating a symphony of love and light that resonates throughout your entire being. As you continue to breathe and visualize, surrender to the profound transformation unfolding within you. Trust in the wisdom and guidance of these divine energies, knowing they are guiding you toward a deeper connection with your sacred self. Let this integration fill you with peace, strength, and healing as we transition into our meditation, guided by the radiant light of the Christ energy, the unwavering presence of your God spark, and the powerful embrace of the quantum twine waves. Now nestle in, relax, and enjoy your miracle moment. Welcome to your miracle moment, designed to tap into the wellspring of wellness that resides within you. This journey begins with the understanding that the path to the collective healing starts at the core of our individual being. As we nurture and restore our own wellness and wholeness, we create ripples that extend beyond ourselves. In cultivating self-love, we find that love extends outward naturally. By healing ourselves, we lay the foundation to contribute to the healing of others. Every act of self-care is a stepping stone toward a healthier humanity, where healing ourselves becomes the catalyst for healing the world around us. Let's begin this process of transformation and embrace the wholeness that is our true nature. To begin, focus your attention inwardly and scan your body gently with your mind's eye. Notice how different areas of your body feel. As you continue this gentle observation, search for a spot within you where you feel a sense of wellness, wholeness, or joy. It might be a warm feeling in your heart, a lightness in your chest, or a calm space in your mind. Should you feel that a space of wellness isn't immediately apparent within your body, allow yourself to gently expand your search. It might reveal itself in a cherished memory, a hopeful vision of the future, or within the quiet depths of your spirit or soul. Trust that your wellness exists within you, in many forms and places, waiting for your recognition. Once you have found this spot of wellness, wholeness, or joy, focus your attention on it. Observe its qualities, how it feels, the sensations that come with it, the sense of completeness it brings. Breathe into this space, and with each breath, envision the sensations of wellness intensifying and becoming more vibrant. Whether it manifests as warmth, a sense of completeness, or an inner glow, feel it as it amplifies within you. Now, with intention, begin to allow this sensation of wellness to expand, like the warmth of the sun spreading at dawn. Let it gracefully move through your body. With each breath, it grows, filling you from head to toe, reaching into every cell, every space within you. Visualize this wellness, wholeness, and joy moving beyond the physical. See it extending into your energetic systems, illuminating them with its wholesome light. It brings balance to your emotions, clarity to your thoughts, and a deep sense of peace to your spirit. As you continue to breathe, a sense of complete wellness encompasses your entire being. You are in harmony with yourself, body, mind, and soul. In this space, you understand wellness, wholeness, and joy are at the heart of your natural state, a core part of who you are. Feeling this wholeness as a steady, unwavering presence within you. It's always there, always accessible. Anytime you wish to reconnect with this feeling, simply turn your focus inward. Now let's embrace a quiet moment together for about 5 minutes. This pause and guidance invites you to personally engage with the quantum twine waves, deepening your connection and enhancing your experience to its fullest potential. When you feel ready, gently bring your awareness back to the present moment. Take a few deep breaths, and when you open your eyes, carry this sense of wellness and wholeness with you, letting it infuse every moment of your day. As we conclude this meditation, step forward with confidence, knowing that the quantum twine waves continue to flow within you. Their positive influences remain active, extending far beyond our shared time in this space. Take this step and every step hereafter with the knowledge that you are blessed.
Welcome back, everyone. Does anybody have any comments or remarks or insights from the meditation from today? Everybody's still asleep. I know it's really relaxing, right? Okay, well, if nobody's got anything to share, then we will close it out. I would do Tracy's closing out. Bring your hands to your head. May we, I forget the wording, something like maybe think kind thoughts, may we speak kind thoughts, and may we go forth with love in our hearts, or something to that effect. I'm terrible at it, but the meaning is still there, and she'll appreciate my attempt. Peace, 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 and namaste.
Namaste.
Have a great day. Love you all.
See you. I won't see you on Monday, Sandy. I'll miss you Monday. I'll be gone traveling.
Oh.
I'll probably miss a couple in a row as I move, so I'll miss you guys.
Miss you.
Okay. See you. Bye. See you guys.
Bye, everybody.
Thanks so much, Kelly.
Have a great week, everybody.
You too. Bye-bye.